going on? Leah Henry here, and super excited at Horizon Fibroids with so much to talk about because there's a topic that's at hand that we don't like to talk about out loud. So I brought Dr. Will here from Horizon Fibroids to talk to me about fibroids and what they are, how women can be treated for them, and what we need to know, because I've heard that, you know, African American women disproportionately are affected by fibroids. So this is something important to me because my mother had fibroids. So for people who don't know, what are fibroids?
Yeah, so uterine fibroids, they're benign masses or tumors within the uterus. And so it's very common. Up to 80% of women by age 50 may develop a fibroid.
Wow.
And luckily only about 15% of those patients develop symptoms large enough or severe enough to find treatment for it. Common symptoms include like heavy menstrual bleeding, heavy cramping. As these fibroids enlarge, I call them bulk symptoms. So women may complain of urinary frequency, going to the bathroom all the time, constipation, bloating, pelvic fullness, lower back pain. So there's a lot of things that can affect women with these fibroids, and unfortunately not all the time women are thinking about it.
Yeah, and I feel like a lot of times when I hear women talk about fibroids, it's like when they're trying to get pregnant. A lot of people don't know because, like you said, some of the symptoms are things we would assume would be with our periods, right? Like, I've always had a heavy period, so I wouldn't know if that was a symptom of fibroids or if that's just, like, to me, what's normal. You know what I mean?
Right.
So, you know, talk me through why it's so important for women to be checked for fibroids and what is kind of that process looking like.
Yeah, so, you know, it's really important, especially from the heavy menstrual bleeding standpoint. You know, if women are having heavy menstrual bleeding for years on a time, they can get anemic. You know, anemic,
me.
Where you get,
That's me.
Where you get, then besides that, you know, with fibroids, with, you know, quality of life, you know, if your cycles are lasting 1 or 2 weeks and they're really severe with bleeding, cramping, also, you know, interpersonal relationships can be affected by fibroids as well.
Yeah, wow. And then talk to me about women of color, right? Because I know that this is something that impacts women of color a little bit more than maybe others. So talk to me about, like, you know, the disparities there.
Right. So women of color, the incidence of fibroids is about 3 to 5 times more severe.
Wow.
Especially in African American women, fibroids not only appear earlier, but also more symptomatic in that demographic. Also, women who've had a family history of fibroids, if their mother and aunt had fibroids, they have like a 3 times higher risk of developing fibroids in their lifetime. Yeah,
wow. And the thing that I love about it is now we're getting more information, more education about it, because my mother had fibroids, and eventually she ended up getting a hysterectomy, which I know that in your practice, you have some methods and techniques as well for people to not necessarily have to get hysterectomies.
Correct. Yeah, so, you know, a lot of times patients will only hear about surgical treatments, and a survey a couple of years ago came out. They found out about a third of women have never heard of fibroids. Over half of women didn't believe they were at risk for fibroids.
Yeah.
And then if their doctor mentioned about fibroids and treatments, it's typically surgical intervention like hysterectomy.
Yeah.
And interesting, in this country, every 3 to 5 minutes a uterus is taken out for fibroids, when a lot of times that's probably not necessary.
Wow. Yeah, That's exactly why I'm here today, because I want my followers to know, I want people to know and have more education. I want women of color, black women, to know more about fibroids and what they can do, what their options are. So I'm really excited, Lemonade Stand, because this is going to be amazing. I'm going on the journey to find out if I have fibroids and what the treatment plans look like. Dr. Will is taking me on the journey here at Horizon Fibroids, so I'm super excited. And stay tuned, because there's more on the way. We're learning more. We're getting all the education we need. But more importantly, we're getting to the health, okay? So we'll be back soon with more. And the next video you see, come with me on my journey.